Hello friends, in this video let us discuss about what a hernia, the disease called hernia is, what are the types of hernia, who all can get hernia, how do you diagnose and what are the symptoms and how can you treat hernia. And also we plan to discuss how a laparoscopic hernia repair works on a patient and what is the new concept of laparoscopic Decker hernia unit, in which a patient comes and gets admitted in the morning, get operated and get discharged in the evening. So let's go to what exactly hernia is. Hernia is an abnormal protrusion of an abdominal organ or a part of organ or an abdominal any other viscera like fat through an abnormal opening or weakness in the muscle wall. This can happen in anybody. For example, a newborn child also can develop a hernia that may be due to a hole in the abdominal muscle, or it can happen in old age where the muscles get weakened. In certain people who cough regularly due to some diseases like tuberculosis, or those who find it difficult to pass motion, those who are chronically constipated, such patients also can develop hernia. Those patients who lift heavy weight, such patients also can develop hernia. Then let's go to types of hernia. 80% of the hernias happens in the lower abdomen, that is in the groin region, and they comes under the category of inguinal hernias and femoral hernias. These occurs through a hole in the abdominal wall through which the testicle, which is present intra-abdominally before birth, passes down to the scrotum immediately before birth. That hole may not get closed, so it forms an opening. So the bowel will come out through this opening, and that is known as an indirect inguinal hernia. If the muscles are weak and the hernia protrudes, that the abdominal organs protrudes to the weakened muscle, that is a direct inguinal hernia. Then you have other hernias like femoral hernias which can happen in the inguinal region. These hernias pass along with the blood vessels which passes from the abdomen to the legs. So such hernias are known as femoral hernias. Then you have other hernias known as incisional hernias, where the hernias occur through a previous scar due to a previous surgery. For example, if you are removing the uterus or a cesarean section, and through that scar if a hernia occurs, it is known as incisional hernias. You have other hernias like epigastric hernia, you have the lumbar hernias and hiatus hernia. Such hernias are in general rare. So who can get hernia? As I previously said, anybody can get hernia. And how do it present with? Generally, hernias present as a bulge, a swelling, and this swelling is generally painless, and once you lie down it gets reduced. As the time progresses, this swelling gets increased in size and the patient starts to develop a dull aching pain, and later on whenever the patient exerts, these hernias becomes painful. Initial stages of hernia, once you lie down or if you give pressure on this bulge, this swelling decreases, but later it becomes irreducible when the size of the hernia becomes very large. So this is what actually a hernia is. And how can you diagnose a hernia? The hernia is basically a clinical diagnosis. The moment patient says, okay, I have these kind of bulge which reduces on lying down, then the diagnosis is certain, it is a hernia. And you can do an ultrasound to find out, is there any other cause of hernia inside. For example, an abdominal tuberculosis can precipitate a hernia. So other blood investigations or other investigations like CT and MRI is not needed to ascertain the diagnosis. And is there any complications? Yes, if the size of the hernia increases, later on it becomes irreducible, that is like it doesn't go inside. So this irreducibility produces pain. So what happens is this bowel will come out of the abdomen, goes to the hernia, and it may get stuck there, and because of that this irreducibility happens. And a prolonged irreducibility suddenly may decrease the blood supply to the intestines, and that becomes a very painful condition known as incarceration of the hernia. Such these two conditions are a surgical emergency and you have to immediately consult the surgeon. You have to rush to the hospital and you may need an emergency surgery to correct the hernias. So what are the treatment options for of hernias? Traditionally, hernias were repaired using open surgical method, in which a 5 to 7 centimeter a cut is made on the abdominal wall. You cut open, you reduce this hernia and you put a mesh, you place a mesh and suture it to close this defect or reinforce this defect. So that is open surgery. But this open surgery, the patient has to get admitted for 3 to 4 days and have to take rest for 1 to 1.5 months, and to return to the routine work will be delayed. Then came the laparoscopic hernia surgery, in which the surgeon makes 2 or 3 small holes, split the muscles. There is no cutting involved, it is only splitting the muscles, going between the layers of the muscle and placing a mesh made of a material polypropylene and reinforcing the weakened area and to close that area. So that is laparoscopic surgery. But presently we discuss more about a daycare laparoscopic surgery, because these hernias are now less painful and the patient can be discharged on the same day. It's because of the latest optics, that is the new laparoscopic machines have come in, new instruments are there, which allows you to do this surgery successfully and with less complications, so that patients can be discharged on the same day. Also added to it is the new developments in the anesthesia. The patients become conscious immediately after surgery. So how does a laparoscopic daycare unit works? So the patient comes and meets the surgeon before surgery, do the necessary investigations and make sure the patient is fit for anesthesia. In such cases, once the patient is fit for anesthesia, patient is given a date for surgery. On the day of surgery, patient comes at early morning 6:30 without having any food or water. He gets admitted, gets prepared and is taken to the theatre at around 9 o'clock. The surgery lasts for around 1 to 1.5 hours. By around 10:30 surgery is over. The patient will be in observation for ICU for 2 hours. After these 2 hours, patient will be allowed to walk, drink some tea or coffee, will be shifted back to the room. Immediately in the room, back in the room, the patient will be taking bath and walking around. So by evening, patient will be fit for discharge. So are there any complications which can occur? Yes, there are few complications which we should be aware. The immediate complications are bleeding. So that is why the patient is kept for observation at least 4 to 5 hours in the hospital. Another complication is this urinary retention. Patient may not pass urine after surgery. In such cases, if the patient is not passing urine by evening, one catheter will be placed and the urine will be let out through that catheter. That catheter will be retained for 2 to 3 hours. Patient will be discharged with the catheter. After 2 to 3 days, the patient will be called back and the catheter will be removed. There are other rare complications like wound infection. The mesh is a foreign body, so that mesh can get infected. Such complications are rare, but mesh infection can occur. The mesh can get rejected, so mesh rejection also can be a complication. The recurrence after laparoscopic hernia repair, that is less, unless the surgeon is less experienced, surgeon is not experienced with laparoscopic repair, the recurrence rate is generally less and it is a safer, painless method of surgery, and the patient can go back to work within 2 to 3 weeks, and 10 days is generally the critical period in which you won't allow the patient to lift any heavy weights or you exert too much, but patient can lift weight of approximately 10 kilos for first 10 days. Only thing is the patient will not be allowed to drive the car or will not be allowed to use a kicker starter bike. Otherwise, patient can climb stairs, can sit, squat and even walk, can go for a brisk walking. Heavy exercises like yoga and gym will be allowed after 21 days. So, what are the advices you give to the patient after getting discharged? If there is any severe pain, because these laparoscopic hernia repairs are generally painless, patient will not have any pain. So, if any pain occurs after discharge, or if the patient is having fever of or if there is any swelling at the site of hernia, or if the patient is not passing motion, or if any redness comes, in such cases the patient is advised to contact the surgeon immediately so that he can tackle the complications as soon as possible. And when can the patient return to his job? Generally after a laparoscopic hernia repair, that too in a laparoscopic day care surgery. After a laparoscopic day care surgery, the patients can go back to work in 10 maximum 10 days. So generally they can go back to work in 4 to 5 days. They can sit and do the work. If they want to travel long distances, they are advised to take rest for around 10 days. And this is exactly what's happening now. The exciting field of herniology has changed patient's perspective towards surgery. Now we go ahead with laparoscopic day care surgical treatment for hernias. Thank you.